Good afternoon, everybody, and thank you so much for joining our webinar today, Wellness Plan Success, Essentials of Compliance and Engagement. My name is Amanda. I'll be your moderator today, and Larry Gurgine is our presenter. There is a whole lot going on with wellness programs right now, as I'm sure you know if you're here. So I know there will be a lot of questions. Don't worry if you miss something. We'll be emailing the recording and the slides to everybody after the webinar concludes. I'll be keeping the webinar on mute for today just to avoid any background noises. But if you look right in your GoToWebinar console, there will be a question box. Please leave any questions you have in the box below, and I'll read them aloud to Larry for you at the end of the webinar. Our next webinar is on February 20th, and we'll be catching up on all of the legislative developments since our last legislative update webinar. And that'll be on Tuesday, February 20th at 1:00 p.m. For now, I'm going to turn it over to Larry.
Amanda, thank you very much. And I will stop during the seminar just to see if we have any questions. So please take up, Amanda, on the offer of going down to the dashboard, looking at the question tab. And if you have a question, make sure you send it to Amanda so we can have a discussion about what we've just talked about. Now, one thing I want to warn you, this area is extremely complicated. And the reason why it's extremely complicated is because there's a number of agencies that have jurisdiction. Almost every governmental agency, every federal government agency has authority in some aspect of wellness programs. And that's what makes this, I think, more complicated, because if you meet one set of regulations, it doesn't mean that you're going to meet all the different aspects of this. And one thing that's interesting about wellness programs, many times employers approach me to saying, what I want to do is I want to encourage, I don't want to do anything sophisticated. I just want to encourage my employees to take, a health risk assessment, take a physical, understand what they're doing, and I want to pay them, give them something in regard to encourage them to take this health risk assessment, which is many times a simplified physical exam. And then once they do that 1 year, they start getting more involved and saying, can we do this or that? Can we encourage them to do other things? And as soon as the employer gets hooked and it gets more complicated, then all these different rules come into play. And that's when, we always have to sit down and decide, if you make this change, this happens. So this is an ongoing process, especially if employers start simply. So what I'm going to do today, and this is the outline of this, I'm going to do today, first I want to talk about the requirements of the HIPAA. Basically, if you start charging employees different amounts for premiums, technically under the HIPAA portability rules, that's a violation of HIPAA. You can't do that, and I'll be talking about that. And then what's been happening, what confuses employers throughout the years, in 2006 and 2013, the government has released regulations on this, and every time they change them, and there's certain aspects of these regulations that are complicated to understand, and I will try to go through them to make sure you understand exactly, to meet those regulations, what you have to do. Now, as soon as you give employees anything of value, the next thing that comes in is the Internal Revenue Code tax. So depending on what you give to the employees, if you give them cash or if they give them a reimbursement of any type, we have to look and see if that payment that you give to the employees is taxable. And under certain circumstances, they are taxable, and other circumstances they're not. And we'll go through that so you can understand exactly under what circumstances any type of wellness benefit could or could not be taxable. Next, we're going to get into ERISA. If you start getting a more sophisticated wellness program and you start having testing and other different services under your wellness program, then it starts inching towards being a medical plan under ERISA. And what that means is then you have to have a plan document, you have to have an SPD, and all the different ERISA rules come in. So you got to be real careful in understanding when ERISA does apply, and I'll be talking about that. Then a few years ago, I think in 2015, for years, the EEOC was somewhat hiding in the bushes, and they would come up with letters, and EEOC comes in two aspects of this. Anytime an employer does any type of medical exams, the EEOC is concerned about ADA and GINA making sure that employees are not being discriminated against. And in 2015, the EEOC came up with regulations, proposed regulations, and in 2016 they came out with final regulations. And what they're concerned about is anytime, in most wellness programs have this, they have medical testing, and in that situation, what the EEOC is concerned about in these regulations, you'll see this, are the programs actually voluntary? Because when you start requiring employees to participate in a wellness program, that's when you run into problems with the EEOC. And under Obama, the EEOC was actually suing employers for certain aspects of their wellness programs, but because what some employers were doing in this circumstance were requiring people to participate, or they were saying, if you don't participate in the wellness program, then we're going to prevent you from participating in any or all of our health plans to force employees to participate. And the EEOC was going around the country and suing employers for doing this. So these regulations came out in 2016. They were effective in 2017. Now, the AARP sued the EEOC in federal court, and just recently in December, the federal court said, you know, what we're going to do, we're going to force you, because the EEOC couldn't justify certain aspects of their regulations. We're going to force you by the end of 2018 to draft new regulations. So I'll be covering that during the seminar, so you understand what's happening. So all this is a fluid situation. And then lastly, certain aspects of the ACA come into play, because if you're giving discounts under your wellness program, that the aspect of it is, okay, what amount of the premium is being used, especially for the employer mandate, for affordability? Do you use it with or without the discount? And that's what most employers, when they have a wellness program, the way they structure the wellness program, if you participate, you get a certain amount off your medical premium. That's the most popular way of doing it. And so there's a concern here, and they came out with regulations in regard to this. What premium you use for the affordability calculation under the employer mandate. Now, throughout this, if you have any questions, please, as I said before, send Amanda the question. I'm more than glad to stop and answer any questions you have. So let's get through this. First of all, we'll look at the HIPAA regulations. Now, generally, what HIPAA does, as I indicated in the beginning, the HIPAA portability and non-discrimination rules indicate that you really can't discriminate against an employee, either in enrollment or premiums, and base it on a health condition. So any type of premium discounts or rebates or differentials is prohibited under HIPAA. The only exception to that is the fact that you have to meet the HIPAA regulations for wellness programs. So you can't give an employee a discount or penalize them for a health condition unless you meet and so this is extremely important. And again, the government came out with regulations starting in 2006, and they amended them, and they're final for 2013. So for violations of HIPAA non-discrimination rules, there's Internal Revenue Code based excise taxes of $100 per day, and then there's DOL audit and civil action against. So, and again, there's a private cause of action, and you know that disgruntled employees love to go to these agencies and complain. So you just have to be careful and make sure, if you're going to do a wellness program, that these first set of regulations are met. So let's look at this. So guidance is provided in the final regulations, And basically what the regulations said that there's really two types of wellness programs. There's what's called the health contingent program. It provides a reward that is contingent on satisfaction of health conditions. This is where that you take a health risk assessment, and in order to get any type of benefit, you have to score at various levels for cholesterol, for blood pressure, for various levels that the employer picks. And depending on how you score, your reward is going to be based on the results of the health risk assessment. So that's why it's called health contingent programs, because basically the way you're doing it, and there's a number of different requirements that have to be met if you have a health contingent type of program. And these are very sophisticated programs that the employer, along with a wellness consultant, will come up with criteria that will come into play if you don't smoke, certain cholesterol levels that the employer feels comfortable in levels, body mass, things like that the employer picks. The other type is simpler, and this is where many employers start, is called the participation wellness programs, where yes, we'll require you to have a rough health risk assessment, a blood draw, but what we're going to do, we're going to give you X amount for just doing it. We're not going to base our rewards on how you score on it. We just want to make sure you know what your health is, and the first step in this is just taking the health risk assessment. So in a nutshell, as this slide says, if you have a health contingent based program, there's 5 specific conditions that you have to meet in order to meet the requirements that are under these regulations. Where basically, if you have participation based under these regulations, you just have to make sure it's available to what's called similarly situated individuals. In layman's language, what that means is you can't just give a discount, for example, to the officers and the owners of the company. It has to be more broad-based. But you can actually put a wellness program for a location or a division. You can do it that way. So you don't necessarily have to provide a wellness program to everyone. You can specify certain populations that you're going to target in the situation. Now, wellness programs, as this slide says, take many forms. It could be a reward for healthier lifestyles. You can, for example, have wellness fairs and lectures, and you get a reduced premium if you quit smoking or reduce cholesterol levels. Or you could just give discounts to employees for just taking the health risk assessment, attending certain meetings. And the HHS has recommended that employers consider providing health promotion and wellness programs and disease management programs as part of the health programs. And many insurance companies are doing this as part of providing medical benefits to their employees. So again, so this slide goes in, is that some wellness programs simply make their services available. And what's important here is that these programs have to be voluntary. I mean, that's what the EEOC indicates. The programs have to be voluntary. You can't force people. What you can do for somebody who doesn't want to participate, you can charge them more, but you can't deny them coverage of anything you get out of the seminar. That's extremely important to understand. These programs have to be voluntary. So again, they key in a lot of services, disease management, caseworkers, as they said in there. So there's various ways. And again, most employers in this situation design the program that rewards are going to be based on a discount of the premium. That's the most common way of doing it. So, and again, rewards offered on wellness programs can vary greatly, from t-shirts to water bottles to significant reductions of premiums, copays, and deductibles. And many employers, when they start these programs, start slow. It says, in addition, the health contingents necessary to qualify reward can vary greatly, from actually quitting smoking and lowering cholesterol to merely, again, if you just attend a smoking cessation program, then you're going to get some type of discount. Now, the most important aspect of any wellness programs is what's called the health risk assessment, or the HRA. This is where the programs start, because in fact the blood draw is and again, these blood draws can be as sophisticated as blood pressure, cholesterol, body mass. It could be a complete physical exam, or it could be just one aspect of it. But this is where most programs start. And again, what most employers do when they're starting their wellness program, say, okay, if you take the health risk assessment, we're going to give you X amount. Could be $50, $100. It could be a very small amount to encourage employees. And many times, wellness companies will come to your location and actually do that. And again, how sophisticated you want to do is up to you as an employer. But as this indicates, that once the initial HRA is used, it's used as a baseline against subsequent assessments. And this is where an employer will build a wellness program saying, okay, this is the initial place that we're baseline that we're using it, and we want you to get healthier. So if you improve on your initial health assessment, then you will be eligible for, or if you maintain your health, that's another reason why we're going to give you a discount or give you some type of cash reward. But again, an employer cannot make taking a health risk assessment mandatory to receive coverage. And that's not only a violation of these HIPAA regulations, but the EEOC regulations too, because these programs, and again, it's extremely important to understand, these programs have to be voluntary. Now, wellness programs that do not condition eligibility for reward are based on the participant's ability to meet certain health standards are permissible, and this is where many employers start a wellness program, just by rewarding individuals that participate. Just take the health risk assessment or participate in some other type of programs. Examples of participation-only programs include initiative to participate in a health fair or testing, excuse me, wellness and waiver and a copayment deductible for baby visits, reimbursement of healthcare membership, reimbursements for smoking cessation program regardless of outcome, and a program that rewards employees to complete a health risk assessment without further action related to health conditions. This is where, as I indicated before, where many employers start their wellness programs. Is the first thing, participation-based programs. Now, in this regard, the second level is what we call the health contingent-based programs. These programs require individuals to satisfy health contingent standards related to health factor as a condition for obtaining reward. In layman's language, what that means is the fact that you as an employer design a program that what you're going to test, how you're going to reward, and what you're going to test for. Now, the health contingent programs are further divided into, and this is what many employers are doing, they'll do a activity-only program, require individuals to complete an activity related to health factor. It could be an exercise program. We want you to go to the gym twice a week. If you do that, we'll give you a discount. So an employer may provide a reward for walking, diet, or exercise program. So if you have, for example, a population that you see that you're getting a lot of health issues because of obesity, and you want people to lose weight, many times employers will then will pay for maybe a Weight Watchers program to come in and give it on site, or a local Weight Watchers program. The outcomes-based program requires individuals to obtain and maintain the specific health outcome in order to get the reward. For example, an employer may provide a reward for not smoking, for obtaining a certain result in a biometric screening, or maintaining a certain body mass index. Now, what's important is if you decide as an employer that you're going to go to a health contingent program, you have to meet 5 different requirements. under the regulations to be compliant with the HIPAA regulations. First of all, the reward must not be more than 30% of the cost of coverage. That's the entire premium. The program must be reasonably designed to promote health and prevent disease. The program must give individuals an opportunity to qualify for reward at least once a year. The reward must be available to all similarly situated individuals, and the program must disclose that alternative health contingencies or waivers are available. Now, the most, I think, important feature of all this is to understand, and this is the feature that drives many employers nuts, is the fact that you must disclose that alternative health contingents are available. What does that mean in layman's language? And I'll give you two examples. First of all, you decide that you see a number of your employees that are smoking and you want to put in a smoking cessation program. And an employee comes to you and said, my doctor said I'm addicted to nicotine, I can't quit. Is there some other way that I can get that credit, get that discount? And basically what you have to do is you have to say, yes, if you take a smoking cessation program and you complete it, well, you don't have to quit smoking, but we'll give you the discount. Or you test for cholesterol level, and an employee comes to you and said, listen, I have a family history of cholesterol, high cholesterol. I take my medications, I exercise, but no matter what I do, my cholesterol will never come down. This is something my whole family lives with for our entire lives. How can I be entitled to reward if my cholesterol actually doesn't go down? Well, you can say to them, as long as you show that you are taking your cholesterol medicine, you're exercising, even though your cholesterol goes down, we're going to still give you that discount. So first of all, the reward must not be more than 30% of the cost and coverage. This is again, depending on who's eligible to reward, if just the employee is eligible for that reward, it is 30% of the single premium. If you have the wife involved with it, it's going to be 30% of the employee plus one coverage. Now, the incentives can be as high as 50% for smoking cessation programs. So, and again, the reward, as this slide indicates, can be in the form of a discount or a rebate of the premium. There's a few employers that actually increase the premium, do it as a penalty. So, but most employers that I've been dealing with do it as a discount. So they'll say the normal premium is X. If you participate in the smoking cessation program, we're going to give you up to a 50% discount if you decide to go through the program. So if only and I just want to emphasize, is if only the employee may participate in the wellness program, the reward must not exceed 30% of the cost of the employee-only coverage. And again, that's the total premium, including the employee contributions. Next, the program must be reasonably designed to promote health and prevent disease. Under this situation, the program meets these requirements if it has a reasonable chance of improving health, it's not overly burdensome, it's not a subject used discriminating against a health factor, and it's not highly suspect a method of choosing to promote health and prevent disease. What does that mean in layman's language? It must be a real program. It cannot be provided to give a discount to an executive that has a particular health disease. So it must be a real life wellness program and not a way of giving certain individuals additional benefits. That's what that is trying to say. The same thing can be said for the next one. The program must be reasonably designed to promote health and prevent disease. There is no need to be scientific record that is chosen a method that promotes wellness. The wellness program must be similar in examples that would be reasonably designed. So it can't be, again, a subterfuge. It must be a program that actually promotes general health and welfare for the employees. That's what that is trying to say. So it's all based on facts and circumstance. And I think in this situation, the more individuals that participate and the more individuals that can get a reward, I think the better that you're going to meet this requirement. And then you have to give employees the opportunity to gain the reward at least once a year. So once a year, and many employers in this situation do it before open enrollment. A few months before open enrollment, they'll roll out the program to say, okay, at open enrollment, whatever you pick, these are the criteria in order to receive a discount. So again, the program can offer more frequent ways of doing it, but again, you could do it twice a year, but at least once a year. So the reward must be available to all similarly situated individuals. That means that both the general health contingent for grouping similarly situated individuals, as I indicated before, what that means is you don't have to offer it to everyone, but it's got to be a significant number of employees at a location, or for example, hourly employees that will benefit. You can't just limit it to the executives or to the owners. That's what I'm trying to say. And this next slide, it says here for activity-based programs, the reward is not available to all similarly situated unless the program allows a reasonable alternative, a waiver of the applicable standard for an individual for whom it is unreasonable difficult due to medical condition to satisfy the otherwise applicable standard, or medically inadvisable to attempt to satisfy the otherwise applicable standard. So if you have a walking program and somebody says, I have difficult walking, but I want to be able to gain that reward, what else can you do for me that I can gain the reward? What other alternative can, and in this situation, in the regulations, there's no really set standard. Each employer has to come up for each individual employee to come up with an alternative from, for example, activity-based that they can do. If you can't walk, can you swim? Can you do other exercises? You know, what can you do in order to, as an activity? So this is something that many employers grapple with in this situation. So in regard to the reward available to similarly situated individuals for outcomes-based program, and again, same thing with activity-based. If an employee cannot come up with the meet the initial standards, what you basically have to do, you have to come up with an alternative. And I gave an example of the cholesterol and smoking cessation programs. And now you don't have to disclose what those alternatives are, but what you have to do is make sure the individual employees understand that they're available. And if you can't meet the standard under the program, you have to come to somebody at HR, and basically we'll work with you. We'll come up with an alternative in order for you to meet the standard. And again, if no alternatives can be gotten, then in this situation, the employer has the option of waiving the requirements. But again, that's the last resort. Now, under outcomes-based program, it is not reasonable to require verification to the health factor. It makes it unreasonably difficult or medically inadvisable for the individual to satisfy the otherwise applicable standard. In other words, you can't ask for a doctor's note. However, if the reasonable standard to outcome-based program is an activity-based program, then the plan may seek verification, if reasonable, under these circumstances with respect to the activity portion of the program. In other words, a doctor's note saying, okay, could you get a doctor's note indicating what type of activity can you do? If it's disease-based, it's a different matter. So in determining the reasonable alternative standard, these are the factors that an employer has to come up with. If a reasonable alternative standard in completion of an educational program, the plan must make the educational program available or assist the employee in finding such a program, and may not require an employee to pay for that program, especially with the smoking cessation program. The time commitment required must be reasonable. If the reasonable alternative standard is a diet program, the program is not required to pay for the cost of food, but must pay for the membership or participation fee. What many employers do in this situation is come up with they may pay for the Weight Watchers program, just for the membership of the Weight Watchers and for the weigh-ins, but they won't pay for the food that's available at Weight Watchers. If an individual's personal physician states that any plan standard, including recommendations of the plan's medical professional, is not medically appropriate for that individual, the plan must provide a reasonable alternative standard that accommodates the recommendations of the individual's personal physician in regard to medical appropriateness. So again, this is one area of the regulations that drives employers nuts. This is very time intensive, and this is something that the employer has to deal with if they have an outcome-based program. And again, as I indicated before, the plan may always waive the applicable standards, but again, that's the last resort. If nothing else works, they're saying, okay, we'll give you the discount if you can't do any activity involved. But reasonable alternative standards may be provided for a class of employees or on an individual by individual basis. The full reward under either an activity or an outcome-based program must be available to all similarly situated individuals. An individual may qualify for satisfying a reasonable standard must be provided the same full reward that is provided to individuals who qualify by satisfying the otherwise applicable standard. So again, you got to be very flexible, and that's what I'm trying to say here. And again, all you have to do in the next slide, you must only disclose that a standard is available. So in an SPD or in your handbook, any employee communication, as this indicates, you don't have to actually spell out the fact that what those reasonable accommodations or standards are. You just have to make the employees cognizant of the fact that if here are our standards, and if you can't meet any one of them, come and talk to us, and then we'll come up with an alternative that you can qualify for in order to get the discount of the reward. And again, this only applies to the health contingent-based programs. All these rules do not apply to the participation programs. So again, the participation programs, as a recap, they don't require any type of, what they only require you to do, for example, just attend a smoking cessation program. Just take the health risk assessment and we'll give you X amount. So that's pretty simple in that regard. Now, Amanda, before we go on to the next area, do we have any questions?
Nope, nothing at the moment.
Okay. Next, I want to go to income tax program, income tax. Anytime you give a benefit to an employee, what you do, you have to check and see whether that payment to the employee would be taxable. And generally, the general rule is if it's, it has to qualify to be non-taxable. It has to qualify as a medical expense or de minimis fringe to be non-taxable. So a wellness program that does not qualify either as an eligible medical expense or a de minimis fringe is taxable to the employee. And the IRS came out with some guidance in 2016 that said cash or non-cash incentives, payments or rewards paid to an employee that are not excludable from the employee's income tax because they are paid under the employer wellness program. So if you give your employees, for example, $50 or $100 for completing a health risk assessment, that is going to be taxable to the employee. So as this slide indicates, for purpose of income and employment taxes, the following items are included as taxable income. So we're talking about cash payments, non-cash reward incentives, and other payments that are not medical care, payment of reimbursements through a wellness program to reimburse employees for all or portion of the premiums, for employees paid on a salary reduction basis. The way to avoid the last one is just to give the employee a reduction. So instead of the, let's say you're going to do a $20, let's say the premium is $100, you're going to give the employees $20. Basically what you do in that circumstance is that you advertise the fact if you complete the requirements of the wellness program, now their premium is only $80. So you don't reimburse them, you don't come under that last bullet right there. And that's how you avoid that taxable issue. So the following items are excludable from income tax, whether paid under a wellness program or not: benefits and services and non-cash rewards that are medical care in nature. In other words, you pay for various programs, biometric screening, smoking cessation program, health risk assessment, you pay for that. So because it's considered medical care, it's not going to be taxable. Rewards and incentives that qualify de minimis fringe benefits. These are defined as property or services whose value is so small that the accounting for them would be unreasonable. And I generally indicate to my clients if they're under $50, there's no problem. Now, two other employer payments that are also excluded from taxable income is group health premiums. If you give a reduction of the premium, that's going to be non-taxable. Or if you do a reward, and the reward is then putting money into an HSA contribution, that $50 or $100, instead of giving them in cash, is then contributed to an HSA under a cafeteria plan, then there's no problem. You can do that, and it won't be taxable to the employee. So there's various ways of avoiding tax issues in that regard. Now, Chief Counsel advice 2017-19-25 indicates enrolling employees participating in a specified no-cost wellness activities receiving payments from fixed payment program. Basically, if you use, for example, payments from a wellness program to pay for premiums for certain indemnity programs, certain of these payments would be taxable, and especially if the payments from these programs are more than the premiums paid. So in this situation, they get large payments from these programs, and it's more than the actual expense. So let's say that the cost of a certain service is $100, and you give them $200. In these situations, those payments would be taxable. So you have to be very careful in that regard. So let's go next to wellness programs and ERISA. Under what circumstances would you have to put a wellness program in a plan document and an SPD? Well, the application it will depend. To the extent that the wellness program provides medical benefits, it will likely be treated as a group health plan subject to a special ERISA rules. And the only guidance we have, the only guidance we have is a DOL letter to a Joseph Dunn from 1993. The DOL indicated the wellness program will be considered providing medical care if it provides programs that are diagnostic or preventive or that coach for certain identified health risks. So generally, the more sophisticated your wellness program is, and you provide, for example, under your wellness program, disease management or other testing, the chances in the situation are that it's going to become a wellness, a ERISA plan, and it's going to be seen as you're providing health care, and therefore you need a plan document and SPD. GINA. Now, what we're talking about, and these are the rules that came out from the EEOC back in 2016. And what they said is if you do any type of testing, underwriting purposes include charging deductibles and other cost sharing mechanisms or providing discounts, rebates, payments, and in-kind mechanisms for activities such as completing a health risk assessment or participating in a wellness program. Family history or other genetic information can be collected for the purpose of collection, is neither for underwriting nor prior to the connection for enrollment. Genetic information includes collection of family medical history. Any wellness program that provides rewards for completing HRAs that request genetic information, including family history, violates the prohibition against requesting genetic information for underwriting purposes. And this is the result even if the rewards are not based on the outcome of the assessment. So you have to be real careful and check with your wellness provider to see exactly under what circumstances that this information is being collected. So genetic information can be collected as long as no rewards are provided. A group health plan or a healthcare insurer can provide rewards for completing health risk assessment as long as the HRA does not collect genetic information. Now, in 2016, released regulation, how GINA affects wellness programs. Prior authorization required. An employer offering an incentive to an employee for the employee's spouse to complete a health risk assessment or biometric screening must obtain a voluntary written authorization from the spouse. A written authorization must describe the type of genetic information that will be obtained and how it would be used, and confidentially protections for the sale, transfer, and disclosure of genetic information. So this enters into if you start doing testing, especially if you start doing testing of family members. Also, they say that what you cannot do, you cannot limit the amount of participation in a program, in a medical program, if somebody doesn't do the testing. A wellness program is required to be voluntary and reasonably designed to promote health and prevent disease. An employer is prohibited from restricting access to particular benefits based on an employee or his or her family member based on spouse's refusal to provide information about the manifestation of disease or disorder in the HRA or biometric testing. What was happening is with the EEOC was finding is some employers were saying, if you don't do the testing, if you or any of your family member don't do the testing, we offer 3 plans. 2 of the 3 won't be offered to you. You're going to be limited to a gateway plan. That's it, 1 plan. But if you do the testing, all 3 plans will be available to you. The EEOC said it's a violation of GINA and you cannot limit that, and employers were sued. Inducements for information from children of employees are prohibited, so children cannot participate in a wellness program. And what they indicated is that there's separate incentives for both employees and spouses. As I indicated before, if the employee is the only one participating, then the reward under the EEOC is only 30% of the individual coverage. If the spouse is also participating, they're separate, again, separate rewards, and she can qualify for another 30% of the premium. But just because the spouse doesn't qualify doesn't affect the employee. That's what that slide says. So you got to be very careful in that regard, how you actually design your wellness programs to make sure that each person participating in the program, both employee and spouse, it doesn't affect the other one. That's what that is saying. Now, these final regulations are prospective in nature, and they were effective January 2017. The final regulations apply to wellness programs connected to group health plans and standalone wellness programs, both. Now, the EEOC also provided regulations according to ADA. So in May of 2016, the EEOC released final regulations on ADA that impacts wellness programs. And again, under ADA, there's no gateway programs. You cannot prohibit someone from participating because of the fact they're not participating in the wellness program. So the EEOC made clear that the ADA prohibits the outright denial or access of a benefit available by virtue of employment, and concluded that such plan designs would discriminate. And there's two rules that the ADA that the employers offering wellness programs and disease management programs should consider carefully. First, the ADA prohibits employment discrimination on disabled individuals, and a wellness or disease management program that require disabled individuals to participate in order to attain benefits equal to those offered to non-disabled individuals might be found to violate this provision. So you cannot eliminate an individual from participating under a program just because they have a health condition. It's a violation of ADA. Second, an ADA limits the circumstance under which an employer may require employees to undergo physical exams or provide answers to medical inquiries. This prohibition on medical exams or inquiries is subject to some exceptions, including exception permits employers to conduct voluntary medical exams and inquiries as part of the employee's health program, a wellness program that offers medical screening or high blood pressure, weight control, or disease management, provided that participation in the program is voluntary. Information obtained is maintained according to the confidentiality requirements of ADA. Information is not used to discriminate against the employees. So the employer has to be very careful. And again, for ADA purposes, with the IRS also, with the EEOC also indicated that the employer has to provide employees a notice. For wellness programs to be considered voluntary, employers must meet the certain conditions. A new notice requirement. Employers participating in wellness programs that involve disability-related inquiries or medical exams must be given the notice that describes the type of information to be collected, the purpose for which the information will be used, the restrictions for disclosure of the information, any employer representatives or other parties for whom the information will be shared, and the methods used to ensure that the information is not improperly disclosed. That notice requirement has to be met. Now, in regard to incentives, again, the final rule retains a 30% cap. This limitation is based on the cost of self-only coverage. And the calculation methods for this is based on the coverage, and this is the coverage that was provided. So here for the incentive limitations, under the EEOC regulation program that require a total incentive cap of 30%, it can be, again, for tobacco, it can be as high as 50%, but you cannot base it on any type of testing for nicotine. If you test for nicotine, what this indicates is that the reward is limited to 30%. If you don't test for nicotine, it can be as high as 50%. Also, with the EEOC indicated, the final rule relates the ADA's confidentiality protections for medical records. Generally, wellness programs that are conducted with a group health plan, they must meet the, again, the privacy and security regulations of HIPAA. The EEOC interpretive guidance states that it's likely that wellness programs that comply with the privacy rule will be compliant. So you have to make sure the information that's contained in the wellness program is only limited to those individuals at the employer that will actually be involved with the program. The general management of the employer, just like your health plan, cannot review the information of the wellness program. Now, they also said for wellness programs that are subject to HIPAA, the EEOC's final rule clarifies that confidentiality is applied to protections which means it also applies to the participation-based programs. So as it says, under these programs, employers offering wellness programs subject to final rule are only permitted to receive information collected as part of the wellness program in aggregate and that does not disclose and is not reasonably likely to disclose the identity of specific individuals except as necessary to administer the program. So what that says in layman's language is only those that are involved with the administration of the program in HR can actually have access to it. No one else at the employer can actually have access to this information. Now, these final regulations were effective in 2017. And again, the final regulations apply to both wellness programs as part of the group health plan, but also freestanding. Now, what's interesting about this, the validity of these regulations have been challenged in court. In August of 2017, a federal court found that the EEOC's interpretation of the ADA's voluntariness requirement was not reasonable and supported by the administrative record created during the rulemaking process. Specifically, the court held that the EEOC has not justified its conclusion that the 30% incentive level is a reasonable interpretation of the term voluntary. Now, what they asked the EEOC to do initially was to review the regs, but they didn't stay the regulations. And this is the side of the actual court case. Just recently, a few weeks ago, in December of 2017, the federal court that sent the EEOC's final regulations back to the agency for reconsideration after finding the incentives arbitrary and capricious has now vacated these provisions effective January 2019, January 1st, 2019. The court declined the AARP's request to block the enforcement. Plan sponsors may continue to comply with the regulations, and the EEOC has indicated it's intended to propose revised regulations by August of 2018, but they'll not be applicable until 2021. So again, everything is in flex in this situation. How does wellness programs affect ACA? First of all, grandfather status. If people bounce back and forth from having awards, not having awards, remember there was a requirement under the ACA that there cannot be a flux of more than 5 percentage points of the employer contribution. If an employee in 1 year did qualify and the next year didn't qualify and the reward is more than 5%, it could blow the employer, the grandfather status of an employer. I warned many employers about that. If you put in a wellness program, it could affect your grandfather status. Secondly, the employer mandate in this situation. Remember that there's affordability requirement under ACA. And the question came in, well, how does the wellness rewards affect the affordability calculation? Under proposed regulations, affordability of the employer-sponsored program is determining in regard to the smoking cessation programs that everybody qualified. So you'd base it on a lower amount of the premium. And any other program, if there was a discount, you would take the higher premium. That's what this slide is trying to say. So again, on affordability, be very careful in that regard. For smoking cessation programs, you take the lower premium, and for any other programs, you take the higher premium. That's what that slide is trying to say. Amanda, do we have any questions?
We do. Give me one moment. Does the EEOC and ADA apply to participatory wellness programs?
Yes, if they're doing testing, yes.
And that's it for now. We do have a few minutes left, so if you have any questions, please type them in the question box below, and I'll be happy to ask them for you. Otherwise, as I mentioned before, our next webinar will be on February 20th at 1:00 p.m. That's Central Time. You can register right at benefitexpress.info. You go to our webinars page. We'll be covering all the legislative updates since our last legislative update, which was about 4 or 5 months ago.
And we're going to go into detail about the benefit provisions of the new tax reform bill. So there are several different important provisions of the tax reform bill, the tax cut bill, that includes benefit provisions. So we're going to be mentioning that and going into detail about that. So that's what we're going to do, okay? If there's not anything else, thank you very much, everybody. We'll see you next month.
Thank you all so much.
Bye-bye.